Now, I wanted to ask you, because we were talking before we started the show today, just a basic question, something that people ask you all the time. What exactly is a root canal and what's involved in that? And I think it's a very good
We've had patients come in all the time who have a horrible toothache, for instance, and they say, just pull it. You know, and I can understand that because they're in horrible pain frequently.
Right.
And I say, well, you know, we can save this tooth with a root canal. And they go, no, I don't want a root canal.
Right.
Because someone told them never get a root canal. And root canals strike fear in the hearts of people. You go back 20 or 30 years and root canals were a horrible procedure. They were usually painful and frequently didn't work, and the person had to have their tooth pulled anyways. So if you can imagine if you went through something like that, a painful procedure, and lost the tooth anyways at great expense, you would never, you tell anyone that you know to never get a root canal.
Of course.
And you know, unfortunately now that reputation still exists. However, it's not like that anymore, and it hasn't been like that for decades. Root canal is a procedure where you essentially remove the nerve from inside the tooth, and you replace that area where the nerve used to a special filling material. I do about 3 root canals a day, and I promise you, you're able to numb the person up or get them comfortable through some other method so they don't feel anything, and it saves the tooth. It really works.
Why does the nerve go bad in the first place?
That's a good question. People ask me that all the time. Why did this happen?
Right.
Most of the time it's because they get a cavity that's gone deep into the tooth. The cavity's gotten into the nerve, and it's carried all the bacteria with it. Now the nerve becomes infected. Okay. And unfortunately, the blood circulation inside of the tooth is very poor, so antibiotic therapy doesn't help.
Right.
So you really need to remove the nerve.
So basically, it's bad dental hygiene. It's just from not looking after your own smile.
Well, no. Sometimes, you know, some people have good hygiene, and things just happen.
Things just still go wrong.
Which is why we're lucky that we have therapies like this that really help to save people's teeth.